Ever considered that garlic, a staple in most kitchens, can be harmful to certain health conditions? It's true. Garlic, celebrated for its flavor-enhancing abilities and its numerous health benefits, may not be the universal panacea we often deem it to be. Indeed, garlic is a powerhouse of nutrition, boasting properties that can bolster your immune system, ward off heart disease, and even combat various types of cancer. Yet like many things in life, it's not for everyone. For those grappling with specific health conditions, this revered bulb can pose some serious concerns. Surprising, isn't it? Over the course of this video, we'll delve deep into these often overlooked health conditions, shedding light on the instances where the benefits of garlic might be outweighed by potential risks. So, buckle up as we journey into the less-known side of garlic consumption. First off on our list is blood disorders. Yes, you heard it right. Garlic, a widely used ingredient in many of our foods, has a lesser-known side that needs our attention. This humble kitchen staple has anticoagulant properties. In plain English, it thins your blood. Now that's not a bad thing in itself. In fact, it's a property that can be beneficial for some, especially those at risk of cardiovascular diseases. But here's the catch. For people with blood disorders or those taking blood-thinning medication, this same property can be problematic. If you're wondering why, let's break it down. Blood disorders often involve issues with clotting. Either the blood clots too much or too little. So, if you already have a clotting disorder, garlic's anticoagulant properties can make your blood too thin, increasing the risk of uncontrolled bleeding. Similarly, if you're on blood-thinning medication, adding garlic to your diet can amplify the effects of your medication, again leading to the risk of excessive bleeding. It's like doubling down on the thinning effect, not exactly what your doctor ordered. With that being said, it doesn't mean you have to eliminate garlic from your diet completely, but moderation is key. Therefore, if you have any blood condition or are on blood-thinning medication, it is advisable to limit your garlic intake. Moving on, let's discuss how garlic can exacerbate digestive issues. Garlic, as delightful as it is, comes with its own set of challenges, particularly for those with sensitive stomachs. This flavorful bulb, loved by many for its pungent kick, can sometimes cause heartburn, stomach upset, and even gas. The compounds responsible for garlic's distinctive aroma and flavor, such as allicin and diallyl sulfides, can be quite potent and may not agree with everyone's digestive system. If you've ever felt a burning sensation in your chest or an uncomfortable rumbling in your belly after a garlic-heavy meal, you've likely experienced this firsthand. And while these symptoms may be mild and temporary for most, for those with existing digestive disorders, they can be significantly more severe. Individuals with irritable bowel syndrome, or IBS for instance, might find that garlic triggers or worsens their symptoms. The same goes for those with gastritis or other conditions characterized by inflammation of the digestive tract. Garlic's strong compounds can irritate the stomach lining, causing discomfort and even pain. So, what's the takeaway here? Well, while garlic is undoubtedly a wonderful addition to our meals, it's not for everyone. If you're dealing with digestive problems, it's important to listen to your body. And sometimes that might mean making the hard choice to skip the extra garlic in your food. So, if you're battling with any digestive issues, it might be best to say no to that extra garlic bread. Third on our list is allergies. Yes, garlic can cause allergic reactions in some people. Imagine this. You're enjoying a garlic-infused dish, when suddenly you feel an uncomfortable itchiness on your skin. You look down to see a rash forming. That's one of the telltale signs that you might be allergic to garlic. Alongside skin rash, other symptoms can include a runny nose, difficulty breathing, and even nausea. These symptoms can range from mild to severe depending on the individual and the amount of garlic consumed. For some, a tiny pinch of garlic can trigger a full-blown allergic reaction, while others may only experience symptoms after consuming a large quantity. Why does this happen, you might ask? Well, it's all down to the immune system. In people with garlic allergies, the immune system identifies garlic as a harmful substance. It then releases chemicals to protect the body, resulting in the symptoms we've just discussed. It's crucial for those with known allergies to garlic to completely avoid it. This might sound tricky considering garlic is a common ingredient in many dishes. However, with careful meal planning and diligent label reading, it's entirely doable. Remember, it's always better to be safe than sorry. If you suspect a garlic allergy, steer clear of it. Tune in for our next segment where we'll be discussing the potential impact of garlic on surgeries. Lastly, let's talk about how garlic can be a concern for those planning to undergo surgery. Garlic is known for its myriad health benefits, but it's also a potent natural anticoagulant. In other words, it can thin your blood. This is generally a good thing, but when you're preparing for surgery, it can become a problem. You see, when your blood is thin, you're at a higher risk of bleeding during and even after surgery. This is why medical professionals often recommend avoiding certain foods and supplements, including garlic, in the weeks leading up to a surgical procedure. So, if you're scheduled for surgery in the next fortnight or so, it would be wise to steer clear of garlic. This will help ensure your body is in the best possible condition to handle the procedure and recover afterwards. So, if you've got a surgery lined up, it might be a good idea to give garlic a miss. Now that we've uncovered the potential health hazards of garlic, let's summarize. Garlic, while widely known for its numerous health benefits, also has a flip side. It can pose risks to individuals with certain health conditions. It's crucial to be aware of these potential hazards, especially if you're dealing with specific health issues. Firstly, we touched on blood disorders. Garlic, with its blood-thinning properties, may exacerbate conditions related to blood clotting. If you're grappling with a blood disorder or taking medications that alter blood clotting, it's vital to be cautious with your garlic intake. Moving on, we discussed digestive issues. While garlic is celebrated for boosting digestion, it can also be a villain for those with sensitive stomachs. It can cause heartburn, gas, nausea, and diarrhea. Therefore, if you're prone to such problems, limiting your garlic consumption might be a wise choice. Next, we talked about allergies. Though rare, garlic allergies do exist and can cause a range of symptoms from mild skin rashes to severe anaphylaxis. If you suspect you're allergic to garlic, it's best to get tested and avoid it if necessary. Lastly, we delved into the concern of garlic in surgery. Due to its ability to thin blood, garlic can increase the risk of bleeding during and after surgery. Therefore, it's generally recommended to stop consuming garlic at least 2 weeks before a scheduled operation. Remember, this information doesn't undermine the health benefits of garlic. Garlic is a powerhouse of essential nutrients and compounds beneficial for our bodies. But it's also essential to understand that what works wonders for one may not be the best for another. It's all about knowing your body and being mindful of its unique needs and sensitivities. In conclusion, if you have blood disorders, digestive issues, garlic allergies, or an upcoming surgery, it's crucial to moderate your garlic intake or avoid it altogether. Always consult with your healthcare provider before making substantial changes to your diet. Remember, while garlic is packed with health benefits, it's not for everyone. Stay informed, stay healthy.